Welcome to Perry's Victory and International Peace Memorial for our virtual Perry Education Days. Now, this is the Butcher's Bill, and I'm Ranger Rob, and if you had to look at these instruments I have on the table, I have one that looks sort of like a hacksaw, long knives, scissor-like ones, smaller knives, sort of a keyhole saw if you're familiar with woodworking tools. And I usually ask people, what do you think these are for? And I get all sorts of answers. When they see this one, a lot of times people think dentist, this wooden handle with a 3-4 inch length piece of metal with a hook in the end. They think dentist for picking out your teeth. They think when they see the hacksaw looking one, or the keyhole saw with the handle and the teeth and the round circular, that they think I'm a woodworker. I've got butcher, I've got an executioner, assassin, all sorts of things. But today I'm dressed as a surgeon from the War of 1812. I got a leather apron on, I have just my normal white shirt, vest on, I got a hat maybe to wipe the sweat off, just something like that, some basic things on. Well, just a little disclaimer here. This is a medical talk. No matter how sort of clean I keep it, there is some mention of blood. Gets kind of disgusting. That's just the nature of this medical talk. There is sort of a baseline. I will warn you, the viewer, when I get to the real gross parts. If you want to stop it, look away, turn the volume down, go right ahead. This is your warning. You do not have to worry. There is no fake blood. There is no mannequin. There is no one. It is just me with the tools, and I'm not going to cut myself. Now, saying that, so these are your tools. Someone comes in, patient, you're a surgeon, battlefield conditions. What do you think might be a common battlefield injury? If you watched our programs yesterday, you might have seen one on a musket demonstration. Think a musket ball injury? Something about this size could be one of your leading things you're going to have to deal with as a surgeon in battlefield conditions? Yes. So patient comes in, you got 4 basic tools here to work. You might be scratching your head. I only see 3 tools right here. Because honestly, patient comes in with a musket ball injury. As a surgeon, I might just first thing do is stick my finger down the hole and try and pull the musket ball out with my fingers. Can't reach it with my finger, basically get a longer finger. This is a bullet probe. You probe in, you find it, pull out your ball forceps, reach into that hole, pull the musket ball out. However, musket balls going in make a hole this big or smaller. You grab onto it. If you have not made the hole bigger already, notice the forceps are wider than the musket ball. I'm making that hole bigger. It is going to be painful. It's going to hurt. There is nothing to numb the pain, really. Nothing to knock them out. Your patients are going to be not just alive, awake most likely, unless they pass out from loss of blood or the pain. You have this nice invention. This is number 4, the Bullet Extractor. Invented about the mid-1600s or so. This one's nice because you look at it, in comparison to this musket ball, this one's more for a rifle, so a little smaller than the musket ball you'd have with a musket. So you hit that, and notice it is just about as wide, if not wider, and figure a musket ball is bigger, as this tool. So you slide it down the hole, and you spin this. And then these threads here, going down this long shaft, will hit that lead ball and drill into that soft lead. And then you can pull that musket ball out of the wound, in theory. Because it worked, I'm sure. However, you go to put down that hole, when you twist that, you think this musket ball is sitting still. No, you're going to have to push against it. It's going to be painful. Also, that musket ball, may have hit bone. It may have flattened out a little. Think this will come out, the hole this thing made. You're going to make that wound bigger. And this gets to a point, back then, surgeons did not know about germs. Back during the War of 1812. It's not much later till they do it. So they have no idea about germs and that cleanliness level. To them, clean is, got a bowl of water here, wipe it on my apron. It's shiny, it's clean. They cannot see germs. So that's one level of cleanliness. Another one is surgeons are start realizing how much work should I go into trying to dig that musket ball out? Because is it worse cutting them open, trying to search for it? Or is it better maybe just, it's still lead poisoning with a lead ball, but is it better if I can't find it easily to pull it out, just leave it in? This is a debate going on in the medical field during this time period. Which is better? Do whatever you can to get it out, or just leave it alone? So now, the next group of wounds. Again, I'm going to back up. If you saw yesterday, we had a carronade talk as well as the musket demonstration. So if you haven't seen them, go back to yesterday's post and you can see those videos. What happens now, a wound, something bigger. That carronade goes off, hits the mast, the yard arm comes down, hits you. Cannonball hits you in the arm or the leg. You now have a broken bone, basically. And there's two types of broken bone injuries back during the War of 1812, just like there's sort of two today. You have what they call simple fracture today. The bone hasn't broken the skin. And so they're going to try to avoid a procedure. You watch any historic movie, it seems like surgeons only know one thing: amputations. They honestly try to avoid it. Why? First of all, this is a procedure that takes time to do. It takes assistance to hold the person down. Battle of Lake Erie, Ushers Parsons, who's the surgeon's mate out here in the Battle of Lake Erie, has 6 people at the beginning of the battle to help him. Throughout the course of the battle, Perry yells down to him to send someone up to help man the guns. Eventually, Parsons is down there by himself doing these surgeries. When Perry yells to him, he has to yell back, "I have no more people to send you." So there's a standpoint, you need people. It takes time to do these procedures. Also now, if Usher Parsons cut off every arm or leg of every broken bone, is that soldier, sailor going to stay in the military? No. Good chance they're going to be sent home. And back in the early 1800s, if you got sent home without an arm or a leg, could you take care of yourself? Probably not. Who's going to take care of you? Your family, your friends. You've now become a burden on them. They have to provide for you. You can't provide for them. Plus, how many officers would be happy that you just cut off arms and legs and someone's going... That's their men. They need men to fight a war. So as much as possible, they tried to avoid it. Someone come in with a simple fracture. The bone hasn't broke through the skin yet. They're going to do what we do today. Just try to strain it out. Bandage it up so you cannot move it. Sort of like a cast today. You can't move it. It heals. You know what? They don't have x-rays back then. But you know what? It's probably going to hopefully be better than if you did not have an arm. It might not be perfect. You might still have pain. But that's their reasoning. Hopefully it's better than not having an arm or a leg. Now, what happens if bone is sticking out of skin? You can't just shove that bone back then during the War of 1812. Or this gets back to the idea of a clean versus dirty. Cannonball may even completely rip an arm or a leg off. Maybe just barely. That is what's considered a dirty wound. Again, they do not know about germs. But where was that cannonball before it hit the person? It was inside a cannon with black powder that exploded with soot all over it now. If you're on land, did it hit the ground first? On ship, did it hit wood? And so you could have any If you saw the uniform talk, look at those wool uniforms. Guess what? You might have some of that in that wound. You have to clean the wound out. So that's when amputation came into play. And you'd start out by putting a tourniquet on. This is a screw type. You got this screw here. You adjust it. This part goes up. The strap that feeds through it tightens around the body. And then you can loose it. You can control it very much. Then you have to determine, this is where things start progressively getting worse. Give you your warning. Where the skin is. If it's all damaged here, guess what? You have to go up a little higher. You want good skin, good muscle to cut into. Take your scalpel, cut through the skin. Capel knife to cut down to the muscle. Yes, it's getting grosser. Then you pull this hacksaw looking tool out. The bone saw. This one is a metacarpal, so this is for like fingers, maybe a wrist, stuff like that. Imagine a longer saw, maybe a foot long or more, for amputating an arm or a leg. And you'd saw through the bone. But before you did that, if you saw cut skin, muscle, bone, all in the same place, do you think that's a good idea? Cutting all straight through? It might seem like it. This is the part they miss in all the movies. This is where you have to have assistance. And this is the very gross part, so if you want to turn the volume down, now's the time. Your assistants grab that skin and that muscle and roll it up like a shirt sleeve. So now when you cut skin, muscle here, you're going to cut bone up higher. You cut through, sawing through. Some surgeons, maybe you get 3/4 of the way through, make it a little quicker, you do a quick snap, break the bone the rest of the way, file it off, and then you slowly wrap that muscle and the skin around that bone to protect it. That's why you're cutting up higher. You slowly release tension. Look for blood vessels. Prior to the War of 1812, you can imagine a tool like this. You got this L-shaped tool with a wood handle, and it has a metal disc on the end. Prior to the War of 1812, they felt just heat this up, cauterize, burn those blood vessels close. By the time of the War of 1812, many surgeons feel if you have the time and are able to, take a hook-like tool like this, you hook the blood vessels and stitch them closed in the wound. Gradually keep releasing the tourniquet till it's off. You bandage it up every couple of days, change the dressings, and hopefully they live. Now I have one more tool here, that keyhole saw. It's a large looking one. This is for a broken bone too. What kind of broken bone do you think this would be? I talked about the saw being for arms and legs. This is for your skull. You're on board ship, rigging, something falls, cracks you on the head. Again, you got a dirty wound. You have to clean it up. Trepanning. That's what this is. This basic concept goes all the way back to the ancient Egyptians. You'd go and you'd put it on top of the head and you'd drill in. Here's another gross part. Usher Parsons out here in the Battle of Lake Erie. A couple days after the battle, he's in the harbor at Put-in Bay doing this procedure on a sailor. Goes in, he picks out a piece of the guy's leather hat, skull. The guy doesn't look good, so he quickly bandages him up, and he dies a couple days later. You might say, what do you expect? You drilled a hole in the guy's head. But you have to remember, this tool goes back to ancient Egyptians. Also, you have to remember, this guy was in a battle. What other injuries did he have? Was it something else that caused him to die? Is it when you're a surgeon during the War of 1812 and you have to work on someone? They come in with a terrible wound. What's going to happen if you do nothing? Good chance they're going to die. Now, what happens if you try something? Worst case is the same. They could die. What's the best case? They make a full recovery. Or it could be something in between. When you're a surgeon, you're faced with these choices, you might as well try something. This also goes back to the medical education of the day. Back then, surgeons, doctors didn't necessarily go to medical school. It was more of a apprenticeship. You found the local town doctor. If they were a good doctor, they let you help, you do some of the things. Guess what? You have a chance of becoming a good doctor. If you spend most of that apprenticeship getting their lunch and getting their horse ready so they can go someplace, are you going to be a good doctor or a bad doctor? Now, you're a surgeon. It's wartime. You get some really terrible wounds. And you finally, there's no bodies for science back then. You get to poke around the inside of the human body. You try something. Maybe it kills the person. Sorry, but you know what? If you did nothing, there's a chance they could have died. Now, you take what you learn from that person. The next battle, you go to work on someone else. Maybe they live. You talk to some other surgeons, you work on your skills, maybe you brush up on some reading. You try it a third time. Person lives again, better, healthier. It's why they call it a practice back then. You practice and hopefully you learn something to help the next guy. And when you're in battlefield conditions, you do nothing, good chance they're going to die anyway. So you might as well try. Experiment a little, talk with other surgeons. And that's what Usher Parsons did after the Battle of Lake Erie. A couple days after the battle, he's talking to the British surgeons, seeing what they're doing probably. Maybe it's just talking and saying how the weather is, but he may be also talking about medical practices of the day. Well, I'd like to thank you for coming and watching my talk today. I encourage you, if you haven't checked out our website, go visit our website. See this list of schedules for the rest of the virtual peri-education days. We have the cooking demonstration, we had the musket demonstration, we have the carronade talk, the uniform talk, a tour of the mine, all sorts of things. Please check those out. Thank you for listening, and thank you for using your national parks.